of President Trump's primary passions are the rural areas of this country. These are the areas that he won overwhelmingly because he was communicating his understandings of their importance and their needs. And you just heard this very erudite description of how rural areas, particularly in Texas, provide the food, the fiber, the energy that we use throughout our country. President Trump also understands that there's a cultural importance to us preserving the rural areas of the country. This is the source of our values, our virtues, our character as a people who came from the small towns, from the rural areas. President Thomas Jefferson said that American democracy is rooted in the tens of thousands of independent freeholders who own the land, and without them, who have a stake in our economy, a stake in our system of government, a stake in our culture. And if we lose rural America, which we're in danger of losing right now, we'll lose part of our capacity to preserve and understand and appreciate the American soul and the American experience. Rural America is in crisis, and the rural hospitals are absolutely critical for them surviving these crises. These institutions are not just medical providers. They're, in most cases, they're the single largest employer in those areas. They have the highest paying jobs. And when they lose them, as we talked about before, it's not just the hospital that closes, it's the pharmacy that closes, it's the stores that close, and the community collapses. So we have to, and President Trump understands this, preserve these rural hospitals, and they were closing at an epidemic rate. And that's why he put in the big, beautiful bill, the Rural Transformation Program. And I'll talk just a little bit about what that will do. Right now, we send about 7%, 6 to 7% of Medicaid dollars to rural hospitals. And that's about a total of $19 billion a year. So they're already getting shortcut. It's a very, very small sliver of what Medicaid pays out goes to these institutions in rural areas. President Trump's big, beautiful bill is going to give $50 billion over 5 years. So that's an infusion of $10 billion a year. That's an over 50% rise in the amount of federal dollars that is now flowing into rural areas. Oh, this bill has the capacity to save these rural hospitals, to give them a chance to stabilize themselves, to right the ship, and then to adopt innovation and workforce changes so that they can survive for the decades into the future. The money, as Governor Abbott pointed out, the first $25 billion of that is going to be distributed evenly to the 50 states. The second $25 billion is going to be distributed based upon a number of metrics, but particularly the quality of the applications. We want to see money spent on infrastructure. We want to see it spent particularly on innovation, adopting telehealth and AI in rural communities. We want to see it spent on workforce quality and quantity improvement, with another staffing crisis that rural hospitals face. And we want it spent on, we want to see proposals that will emphasize holistic care, preventative care, value-based care, and physical health, exercise, food, these kind of things, and rebuilding the infrastructure of these facilities so that they can last for generations. The applications are coming out. The deadline is coming very, very quickly. And so we met with the rural health providers today, and we encouraged them to cooperate. We didn't really have to encourage them because they already have extraordinary cooperative relationships with each other. They came up during our meeting with a series of ideas that every one of them, from a personal point of view, I wanted to fund. As they're the kind of ideas that could propagate and spread, and that were very, very thoughtfully crafted, and we'd like to see those kind of things adopted throughout the country. I think you have an extraordinary quality of leadership in these rural health care in this state. I'm very confident that the application is going to be a stellar one. One of the things that I talked about with Governor Abbott is that part of the score is going to be how well the state has done at adopting kind of MAHA legislation. And Texas now leads the country, so I think they're going to do very, very well in their application. The decisions will be made by December 1st. We will evaluate all the applications, and then the money will be distributed starting in January. And so I've encouraged Governor Abbott and these wonderful leaders behind me to work as hard as they can to come up with the most innovative solution. I want to say one other thing that is going to benefit rural hospitals in this country. President Trump has signed an executive order that requires when we at HHS or the other federal agencies want to adopt a new regulation, we first have to get rid of 10 existing regulations. And the rural hospitals are very, very badly overregulated, and it's one of the reasons they have very high costs. We've encouraged the people in this room to provide us regulations that are impediments to them providing good care to their patients, and we will do everything we can to get rid of those regulations, to untie their hands, to allow innovation to flourish, to turn every county in Texas into a laboratory for healthcare innovation. And let's get in the AI and the telehealth and all of these entrepreneurial changes that we can have when you have such a brilliant, thoughtful, and imaginative leadership in the state.